evening. I'm Dr. Dan Fortenbacher, founder of WA Vision Therapy, and it is my pleasure to welcome you to the third episode of the Luminary Program brought to you by WA Vision Therapy, where our mission is to help bring awareness and understanding of developmental vision and neuro-optometric vision rehabilitation. In this episode, we'll be featuring world-renowned expert Dr. Carl Hillier presenting on the topic of vision and learning, ending the senseless struggle. In addition, joining us tonight is Dr. Alyssa Pars, our Grand Rapids partner and clinic director, and Dr. Alicia Boltzma, our St. Joseph clinic director. But first, allow me to introduce our special guest, Dr. Carl Hillier. Dr. Hillier is board certified in developmental vision and rehabilitation and lectures nationally and internationally on topics related to vision and learning, sports vision, and vision rehabilitation for those who suffered a traumatic brain injury. In addition to his lectures in Europe and throughout the United States, he presents lectures to the Departments of Education and Nursing at San Diego State University, the California School of Professional Psychology, the California Optometric Association, the Southern California College of Optometry, the National Academy of Sports Vision, the American Optometric Association, the College of Optometrists in Vision Development, and the University of San Diego School of Medicine Sports Medicine Fellowship Program. Wow, Dr. Hillier, that's quite a list. And it's really great to have you as our guest on tonight's episode of the Luminary Program. Dr.
Well,
Hillier.
thanks, Dan, Alicia, and Dr. Alyssa as well. So it's wonderful being here. You know, I've spent a long time doing this kind of work, and to be able to share some of the experiences I've had and some of the insights that I might be able to provide. Anything I can do to help this population of children that have difficulties with learning I'm all about it. So thanks for having me.
That's great. And absolutely, when we consider all of the categories of visual problems that we address in developmental vision and rehabilitation, this one involving vision and learning is no doubt the most common in the pediatric population, yet unfortunately for many children affected, too often they're overlooked. Doctors, what are your thoughts?
Yeah, I totally agree. I think it's definitely an area that a lot of times gets missed, that, you know, we don't know about how this child is seeing, maybe seeing double, blurry vision, losing their place. And not only does that impact their performance in school, but also just overall self-confidence, anxiety levels, and, you know, all of that can be hugely affected by the visual system.
Yeah, and I think the labels that get put on these kids is so kind of demoralizing to them when they get labeled with something that really is a visual problem and can be fixed through the work that we do.
Yeah, exactly. And with that being said, let's turn it over to Dr. Hillier. Carl, take it from here.
I agree. I mean, the topic of vision and learning might be the most important area of vision care that there is, because all of us, whether we're children or adults, are in a constant process of learning and acquiring new information. And so much of that is through the written word, but much of it is through general spatial activities that we all engage in, whether it be sports or driving or anything else. So much of what we do is so involved with vision and with learning in general. So, and eye health and seeing clearly are crucial as well, and should be the first step in evaluating the visual system. You know, it's the eyes lead the way in visual learning, as about 70% of what's learned in the classroom comes from the visual system. So the eyes are the first point of input that light has to the individual. So it's crucial that the eyes are evaluated, because after the eyes detect light, it's the visual pathways to and from the brain and the eye that result in learning. So by evaluating the pathways into the brain, optometrists determine where the difficulties lie, and individuals with learning challenges finally have an opportunity to be understood instead of being misunderstood. You know, adults have the same issues, especially as you mentioned, Dan. You know, after a concussion, it can be pretty disruptive to be an active, normal learner, and then you get a concussion, say playing soccer in college, and all of a sudden you're back down to a level of learning that's nowhere near what you are accustomed to. So it's really important. So after that light hits the eye, these pathways into the brain are further evaluated with children, with neuroatypical children, such as those along the autistic spectrum, as well as those with ADHD. So it's a big topic, and we have 30 minutes. I want to cover the most essential aspects of it, so that we can all have a global understanding of how this all works within an individual. So I'll go ahead and show you a few slides. One of the slides here has to do with definitions. Let me go back one here. So visual processing, we have to kind of define some things here. So visual processing and what is learning. So we have to talk about these things. I think not making definitions oftentimes leads to misunderstandings regarding vision and learning. So I always like to start with definitions so that we're on the same page. Now, my definitions don't have to be the correct definitions necessarily, but I think you'll see that these are broadly acceptable definitions to most everyone in vision care and also in education. So let's talk about visual processing. So detecting light with clear eyesight from healthy eyes is the first step. So the ability to simply detect light is important. That's the first step in the process of learning. The second step is to be able to derive meaning that involves multisensory integration and engagement with the body. So in other words, to derive meaning from that light involves multisensory engagement in whatever that light source is coming from, and to be able to manipulate that information either by grasping it or moving our body to and from whatever we're looking at is really an important process in learning. And then finally, having that motor capacity to move is acted on. So we have to be able to respond to the light. In general, the individual moves toward the information they're seeking to learn something about, or moves away from it, or they're steady and they reflect on what they're actually seeing. So the first step in visual processing involves detecting light, deriving meaning, and then having the ability to move in response to that. Now, learning, we can define learning as well, and I think that's important. So learning, the first step is parallel division. We have to derive meaning from what's being experienced. And the second step is establishing the relationship to what is already known, okay, because we have to connect that, because we build on things we already know. And then finally, remembering it so that we can recall it later for future use. So we have to derive meaning, establish a relationship of what we're now learning to something we already know, and then be able to recall that information that's been put into memory so that we can use it later. So I think if we all understand these sequence of events to be crucial for learning, we'll all understand this whole aspect of visual processing more completely. Now, visual processing evaluations and eye examinations, what's the difference between those two? Well, they're really the same thing. And the eye, we literally move our brains around to scan the environment that we're in. And the eyes are the only part of our brain that we can literally consciously move around. So whenever you see somebody moving their eyes left and right, up and down, converging, diverging into the distance, we're actually watching that individual move the front of their brain to access environmental information. And so it's kind of an exciting way to think about it. And these pathways that help move the eye, or that is the front of the brain, around to scan information, are involved in the motor pathways of the brain. There's 6 voluntary muscles around each eye, and there's 3 critical motor pathways that enter into and out of the brain to control these muscles. And we choose to move our brain to access this information. So these pathways are evaluated in eye examinations, but I'd rather you now think of eye examinations as visual processing evaluations, because that's really what we're doing. Because we've now entered into the most important pathway into the brain, and that's our analysis of what we see. So this eye movement control pathway is the first step in being able to organize and gather information to our brain. And this pathway allows us to read, it allows us to catch a ball, it allows us to drive, and it's a voluntary pathway, like I said. And because it's a voluntary pathway, we can learn to develop it more skillfully. We can become more skillful in being able to direct our brains to access information more efficiently for longer periods of time with less effort. Now, the visual processing evaluation and eye examinations are crucial because 2/3 of all the nerves that enter the brain come from the eyes. 3 million nerves leave the eyes and travel into our brain, and 2/3 of them originate from the eyes. 1/3 is left over for auditory processing, vestibular processing, touch, taste, smell, proprioception, interoception, and gustatory. So we don't think about proprioception and interoception and gustatory very much, but Interoception is the knowledge of the feeling of the inside of our body, often related to emotional relationships to what we're seeing and what we're experiencing. Proprioception is the knowledge of the position of our body relative to other parts of our body, to know where our body is in space. And gustatory is the ability for us to recognize what we've pretty much our digestive tract, what we've eaten, if we're hungry or not, things like that. But 2/3 of these 3 million nerves that enter the brain are only coming in from the visual system, 1 million from each eye. And then, so that's 2 million. And then another million is left over for these other sensory processes. So this is another reason why optometric vision therapy is so effective in improving performance, because it engages the vast majority of nerve pathways that enter the brain. I say optometric vision therapy because modifying the way that light enters the brain through the eyes can be very supportive of visual learning. Optometrists are uniquely trained and qualified to use lenses and prisms and filters to arrange for optimal input of that light into the eye, which then results in input to these pathways into the brain for processing and for learning. So these visual pathways are really important to study. And when we look at these pathways, we're looking at the visual pathways that involve perception, attention, and memory. And these are the 3 most complicated pathways into the brain, and they're probably the most crucial when it comes to being able to learn. So optometrist designs perceptual testing batteries to evaluate these pathways. And it's important to first determine that children have these intact abilities to point and focus their eyes for the demands of testing. Otherwise, children are often misunderstood to have ADHD, learning disabilities, lack of desire, or even diminished intelligence. So the psychologists that I work with and the OTs and PTs that I work with and speech and language pathologists that we work with routinely understand that to ensure the validity of their testing that they're about to perform, they need to ensure that the visual system is prepared to engage in that testing activity. I mean, for sure, if a child can't see clearly, or if they're seeing double, or if they can't track and move their eyes when and where they want to, how can it be determined that the results of these tests that other professionals give are valid or not? Now, sometimes it's after the fact. So we have perceptual testing, we have psychological testing, we have speech and language and physical therapy testing that's being done, the testing from reading specialists. And then we'll look at the reports and we'll have to collaborate and be a part of the team, and by sharing with them that there could have been some visual challenges that might have interfered with the results of these tests. So a collaborative team approach is what we're looking for here. So this alone, this evaluation of the testing alone will save many children from being misunderstood and may reveal a therapeutic route to keep them from struggling in school. So it's a collaborative approach that I'm most interested in here. So since more of our brain is involved with vision than auditory processing, and since vision and sensory integration, audition must be successfully collaborating with efficient learning to take place. So in other words, most of the brain is involved with vision, but without auditory processing and sensory integration, we really can't learn very efficiently. So we must collaborate with these other professionals to do this. The brain's so complex, there's no way that one profession can evaluate and develop, understand the development of the whole system. So
I have a question for you then, Dr. Hillier, on that to kind of spin off. Is a lot of times we're taught in school that the eyes send a signal to the occipital lobe, and that's where that's where it's all happening, right? But
right.
Like you said, it occupies the whole brain. Could you elaborate on that a little bit, please?
Well, yes. I mean, it's interesting. About 87% of the nerves that leave the eye go directly back to occipital lobe, and that's true. But about 17% of them go right into the midbrain to initiate postural mechanisms in preparation for movement. And these nerves, this nerve pathway is an unconscious pathway. And they're nerves that are supplied by what's called magnocellular neurons. And this pathway is a very fast-acting nervous pathway that prepares the body and other sensory systems for alertness and preparedness for being present in the environment that the individual is in. And this pathway even precedes conscious awareness. And it's coming from the eyes, going right into the midbrain. The individual is reflexively prepared to contend with movement, to contend with what's about to happen. And as a matter of fact, can even detect motion and movement of things that are happening in the environment before we're consciously aware of them. And then the 87 or the 83% or so of the nerves that leave the eye do go to occipital lobe and then feed forward in two separate pathways, a ventral pathway and a superior pathway. They both provide different input to the system. The ventral pathway is more about what things are and labels of what they are. They're associated with language, spoken language, and written language. And the superior pathway is more to how do we engage in these activities? What is the nature of them? What do they afford us in terms of movement and manipulation? So you're right. I mean, it goes to occipital lobe, at least maybe 85% or so of these go to occipital lobe for ultimate visual processing as we think of it to be. But about 15% of it or so goes into the midbrain in preparation for pre-conscious awareness and movement.
Very good.
Some of these pathways go right to the frontal lobe for processing and analyzing and prioritizing attention. And then they go back to motor systems to then initiate movement depending on what that attention tells us to do.
Thank you.
Yeah. So it's quite and you can see that optometry is certainly involved in this because that's the visual input and the forward information into the rest of these sensory motor systems. But now we need to work with OT. We need to work with physical therapy. We need to work with speech and language therapists as well, and psychology to better understand how all this might come together in the child who's struggling with learning. But my point here is that vision continues to be misunderstood as being 20/20, being perfect vision, to have an eye exam. And I think we just need to start thinking about the eye exam as really being the first step in a visual information processing evaluation. There's so much processing that goes on in the brain and feed forwarding to the eye, and then the eye feed forwarding back to the brain. So there's a cycle of events here that go far beyond being able to see clearly. Now, seeing clearly is critically important and having healthy eyes, but what we're doing as optometrists goes far beyond that. And I think that many other professions, until we really help them understand the breadth of what we do, still are falling back into the concept that, well, maybe if they've had their vision screened and they can see clearly, then they're all set and prepared to engage in the perceptual or linguistic testing that I'm about to perform. And most OTs and psychologists and PTs and speech and language professionals realize that that's the case. And so they do want to collaborate with optometrists to understand this whole pathway. So that's a great question. I think it's an important question to ask, like, where do these pathways go? And so an example of visual processing and learning can be with reading. So this little girl here has no idea what she's about to confront when it comes to reading, but her visual system is certainly learning to be prepared. And it's going to take a little while for her to realize what written language is all about. Now, I want to break down reading into, it's kind of the third tier when it comes to communication. So communication is the idea. Human beings communicate with each other. And maybe that's been going on for probably 100,000 years or so. Language in the sense of abstract symbols, whether they be auditory symbols or movement or gesture, has probably been going on for about that long. More formalized reading, or more formalized language, I should say, is probably maybe 10,000 years old, with sequences of gestures and symbols. But reading has been around probably for about 5,000 years, and cultures have made this up. Language, whether it be spoken or gestural, graphic or written form, is made up by cultures in order to communicate within communities, so that group activities can be performed more efficiently. But written language is a code. It's literally a code. People made it up. And we know that there's so many different languages around the world, and each culture made up their own code to associate with spoken language sounds. And so now what we contend with is abstract written language symbols that represent spoken language sounds, which are called phonemes. And so in English, there's about 45 different language sounds that we use. These are 45 different phonemes. But we have language symbols, visual language symbols that are supposed to relate to these auditory phonemes. And it's a code, it's a literal code. And so if you can break the code, you can read, you can begin to read. And this is called decoding. I mean, we actually call it decoding because it is a code that we have to learn to decode. And spelling is referred to encoding. So most people can learn this code, but some people can't. And when you can't, it causes significant anguish and anxiety and frustration and failure in school, because so many times people are considered to be, as an adult, they're considered to be unable to engage in intellectual activities that others can't engage in. And we know that when there's difficulty with reading, it simply means you can't break that code. It has nothing to do with your intellect or your effort or your previous academic experience. Some of it, unfortunately, is because of overlooked and misunderstood or undiagnosed visual conditions that can interfere or block an individual's ability to engage in breaking that code because of deeper perceptual difficulties, visual memory difficulties, eye movement control difficulties. It goes on and on and on. So it's really an unfortunate situation for lots of people. So going on further with reading, just to give a little bit more deeper understanding of it, when teachers, when tutors, when reading specialists teach people to read, there's two general approaches to it. One is whole word processing, which is a visual process, and there's phonetic decoding, which is a visual then auditory process. But for sighted individuals, vision is the first step. And what's interesting, of course, this has nothing to do with seeing 20/20. So the first step has everything to do with what happens after the eyes detect the light and with the pathways to the brain that direct the visual focus, the eyes coordinating with each other, and to move from one point to another on the page to gather what is offered by the author in a sequential manner in a spatial array. The sequential access of information requires saccades, a very specific kind of eye movement that's responsible for gathering information in a sequential order. But the spatial array is oftentimes organized because the binocular system is gathering that information and locking it into a spatial array that makes sense and that's coherent and understandable. Well, when those things don't happen, you can see on the page, on my slide here, what it might look like for somebody. But if things can be organized by these saccades and by the binocular system, the second step is to appreciate and recognize the visual language symbols themselves. Well, that involves visual perception and visual memory. So the third step is either to use direct recognition of the word based on its visual qualities. That's the whole word processing that teachers teach. Or to match the sequence of these visual language symbols to agreed upon language sounds. And that's phonetic decoding, using the phonemes as an awareness link to the visual symbols that are being displayed on the page. But regardless, no matter what, whether we're teaching whole word processing or phonetic decoding, vision is the first step. So we have to ensure that the eye is healthy and seeing clearly and can track and focus and work together as a team. So this whole word processing, if it's working, is great. If it's not, it's almost cruel to expect a child to be able to make sense out of what they're looking at. So we're really doing vision processing evaluations, not simply an eye exam. And to review, I mean, an eye movement control evaluation is critical and it's a part of every eye examination. So I'll call it a visual processing evaluation. Near clarity is also part of a visual processing evaluation, has nothing to do with distance visual acuity or 20/20. Are both eyes synchronized or not? Our eyes are not connected in any way. The only way they're connected is by each eye sending information to our brain then sending information back out to the eyes and coordinating both of them together. So it's just like our hands. Our hands aren't connected to each other, but they work together only because our brain teaches them how to work together. That's what happens within the visual system too, and that has to be evaluated. And then finally, visual perception is the ability to appreciate figure ground and visual closure, form constancy, size constancy, laterality, and directionality. All these really important visual perceptual skills that enable us to derive meaning from the language symbols that we're looking at. And then matching vision with other sensory and muscular systems, such as the auditory system and the vestibular system, enables the individual to engage in the real world and experience the life situations that these written language symbols are trying to describe. To derive meaning from the environment enables visual language symbols to have meaning. And then finally, being able to recall from visual memory what these words are all about, what they're trying to convey, is absolutely essential. Otherwise, reading is just an act of parroting what the words are saying rather than engaging and truly appreciating what the full depth of what these images that are created from written words, what they really mean. So optometrists want to end the senseless struggle through a team approach of collaborating professionals. Collaborating professionals is the way to do it. And I don't think I'm being naive in saying or trying to make optometry elevated to the most important profession here, but the first step is vision. Now, there are people that read through Braille, and that's, of course, that's reading as well, but I'm talking about the normal-sighted individual who can see clearly. The first step is vision. So my mission in my profession is to engage in a collaborative effort with all variety of professionals that work with vision and reading so they can work together as a team. I would love all children that are having issues with learning challenges, reading challenges, to ensure that their full range of visual skills are available to them so they can access those skills and have a free access to academic information in the classroom. It'll prevent a child from experiencing this tragedy of being mislabeled because the full range of visual skills weren't evaluated before learning was expected to take place. That can't happen anymore. We need to get optometrists involved in every single IEP meeting, every single IEE, independent evaluation meeting, anyone that's involved at all with children and learning. That's the goal here. So that's my spiel, and I'm hoping that does help get a general perspective of what's going on, especially and specifically with reading as well.
Yeah, that's wonderful, Dr. Hillier. That was really, really enlightening. And I mean, there's so many different directions we can go, questions and so forth. And it's what you described is so eloquent, and that it describes the neural software, in essence, that needs to develop on its own naturally. Of course, there's a group of kiddos that may have lost it due to a neurological event, but that neural software is what we're describing here that enables us to, in essence, take in information and make sense of it and then integrate it.
Yeah, it does. And it's a team. OTs help children develop the movement skills necessary to physically engage the world in a multisensory way. That, when it's matched with vision, makes reading fulfilling, because then when you look at written language symbols that describe a physical event, it's an enriching experience rather than just, looking at words and saying what they say. Mm-hmm.
Exactly. And since that neural software is learned, that's something that can be developed. And so that's where there's a place to find the help they need to.
And that occurs throughout life. Yeah.
Yep. Yeah. Any questions, doctors?
What would you say is the overall prevalence of these types of vision-related learning problems in population? Boy,
that's an important question, and it's a sad answer. But For boys, it's a little different than girls sometimes, but I would say for boys, I would say easily 1 out of every 4 boys that have an issue with learning disabilities has a visual problem. And it might be something like 1 out of 6 girls. The boys' development is a little bit slower than girls early on in elementary school, so they don't develop these attentional skills, these visual memory skills and visual integration skills as easily sometimes. And then to apply them to written language symbols is more challenging for them. So unfortunately, depending on what skill you look at, you might have 25% of those with learning disabilities having an issue, and sometimes up to 60%. Sometimes a tracking issue with, because these are rarely detected until after the fact. That's why we can gather this information. So after the fact, we can see sometimes that there's difficulty with tracking in the majority of children with learning disabilities.
What do you think too about patients that maybe have already, those kiddos that have been diagnosed with dyslexia, prevalence in those kids with binocular vision dysfunctions?
It's been shown that more often than not, those that have been diagnosed with dyslexia have a visual dysfunction. And as you know, there's all these different varieties of dyslexia. There's a surface dyslexia, which it's a visual type of dyslexia, dysidesia, they used to call it. That is, now they call it surface dyslexia, which involves visual perception, visual spatial difficulties. And so for them, gosh, that's the diagnosis. But for those with phonemic awareness difficulties or phonetic difficulties or dysphonesia, for them, even they have a significant amount of visual difficulties that interfere. And so probably I would say, in my experience, around 30% of them have about a difficulty with binocular dysfunction or accommodative dysfunction or ocular motor difficulties. And it's been shown through research that even if you have a dysphonetic type of dyslexia, if you have a visual binocular dysfunction along with that, it's even more devastating. So if we can remove the layers of difficulty, if we can remove the layer of visual interference to these children, at least they're not struggling with that. And they can more readily benefit from academic intervention. Yeah.
Mm-hmm. Definitely. I think it makes so much sense with what you're saying, especially those cases, the collaborative approach of getting the visual system where it needs to be and then getting the right professionals on board to then take it after that.
Yeah, and I agree that the majority of children with dyslexia do have a dysphonetic type of dyslexia, more of an auditory-based issue. But unfortunately, easily maybe half of those also have visual challenges. And so let's eliminate that, make the therapy more effective because they no longer contend with the visual issues that are there. Yeah.
Thanks.
Yeah.
You're welcome.
Very good. Any other thoughts, and also any comments from the attendees in chat? If there's any questions from the audience, feel free to enter those in. I think that from a standpoint of treatment, that's where a lot of what we're describing are possible causes of this, whether it be the coordination of the eyes, the ability to make sense of what you see, and then integrating that. What about the treatment side of it, Carl? What do you think about in terms of how would you describe the process of vision rehabilitation for that?
Well, it's clear through, neuropsychology and those that study the visual system and visual development from a neurological standpoint. We have a lot of people from UCSD here in San Diego that study this very deeply, and they understand that the brain is learning throughout life. And yes, there are more neurons developed and there's more pathways developed in a quicker and more complete way when you're younger. But learning is an ongoing process. And since visual input to the brain is the dominant input to the brain, it's really an amazing situation when you do vision therapy to make changes in binocular skill level, tracking skill level, all the voluntary movements of the eyes. These are not difficult to treat. Usually a treatment program might take anywhere from 5 to 6, 7 months of time for a neurotypical child to go through a vision therapy program and discover that they now have access to academic information. And the reason for that, why it's so much quicker than, say, speech and language therapy or occupational therapy, is because we're really enriching the visual input during the process of vision therapy. So it's usually a fun process for children, usually coming into the office once a week for an hour for like I said, anywhere from 5 months, sometimes even 4 months to 7 or 8 months is a fun activity. It's a fulfilling activity for them because they understand the nature of their challenges and they actually experience overcoming them. So it's not difficult. The equipment's not difficult, and it's relatively inexpensive compared to some of the other therapies that are involved. Sometimes it's involved, like I said, it takes years to overcome some of these challenges. And so if we can front load it by being visually prepared, all the other things are much easier to acquire.
Yeah, well said. Well said. Well, unless you have any other questions, doctors, I think we've reached the end of our time. Thank you, Dr. Hillier. That was very enlightening. Just really appreciate that. And to Dr. Pars and Dr. Polsma for your thoughts as well. And for our viewers, our next episode of the Luminary Program is scheduled to air on July 27, 2023 at 7 p.m. Eastern Time, where the topic will be on amblyopia, understanding advanced treatments for lazy eye. And don't forget, you can stream the Luminary Program from the WA Vision Therapy YouTube channel, where each episode is available to everyone free of charge. Thanks for watching.